We're going to change gears a little bit and talk about the improvements in maternal and early newborn care at the hospitals across Trinidad and Tobago. And to do that, I have Dr. Adesh Surju Singh, who is the Director of Women's Health, and Dr. Brickell Timothy, who is a Special Medical Officer from Sangre Grande, is it?
Yes, correct.
And we've always heard great things about the care for mothers and newborn babies at Sangre Grande.
It's
Good morning.
Good morning. Good morning.
As you say, it's excellent. What makes Sangre Grande so special?
Sangre Grande is unique because it's, quote unquote, in a rural area. And with that, you have persons with a sense of camaraderie, a sense of community. And so patients feel that when they come into the hospital, internationally we talk about multidisciplinary care, but at Sangre Grande it really takes a whole hospital, everybody included, the porters, the security guards. It's just a community hospital, and so patients feel that a lot.
For a long time, I've been hearing people boasting about the wonderful care that Sangre Grande has been giving, Dr. Surju Singh.
Yes, so she isn't seeing the full truth of the matter. So about 8 years ago, it was really a district hospital with very limited staff, and we were not keeping up with improvements in maternal care. But I actually used that hospital as a model to roll out advances throughout the whole country. So for the past 8 years, actually, I was in charge of that institution, and I had brought along great staff, including Brickell here. We trained them up. We left it in good hands, but we made a lot of advancements with technology, the wards, the conveniences, and again, we made it a family-centered approach. And that's something I have now rolling out at the Ministry of Health, where I am in the position of the Director of Women's Health. I've been in there for just over a year at the Ministry of Health, so it's a new position. And we've been focusing and coordinating efforts to improve maternal and neonatal care at our nation's hospital. We've actually done quite a lot in the last year, especially with coordination of all of the RHAs, the public sector and the private sector, to make those advances.
You talk about neonatal care and maternal care. One thing the Ministry of Health has been boasting about is a decrease in the number of maternal deaths. What is the figure now? Right. Is there any? Has there been any for 2018?
Yes. Well, unfortunately, yes. It's health, and people unfortunately die. What we are trying to reduce are deaths from what's called direct causes, things that are avoidable. And we've had no avoidable deaths. For the first 6 months of the year, we actually had no deaths. We were very happy with that. But then there were 3 deaths for the past 2 months. And these are mothers who had illnesses that they were ill before coming into pregnancy. So these are things that Dr. Beaumont would like to add something on.
Yeah.
Dr. Surju makes a very good point. What he meant by avoidable deaths is things like patients bleeding after pregnancy. The Ministry of Health did lots and lots of work in terms of staff training and implemented protocols to deal with that. So I'd like to say that we've pretty much come on top of issues like that. What he's speaking about, indirect deaths, when women come into pregnancy already unhealthy. So what we're trying to do through education is to tell people, to tell women that your health, even before you're pregnant, is important. It has whatever medical condition you have. Let's say it's high blood pressure, let's say it's diabetes, seizures, asthma. The general rule is if you get that controlled before pregnancy, the more likely it is to be controlled in pregnancy, and the more likely you are to have a healthy pregnancy.
So you need to go by your doctor and check up as much as you can.
Exactly.
It's about preparing for pregnancy, and in some cases we actually have to advise contraception for some to avoid pregnancy.
Really?
That's actually the number one way of reducing maternal mortality and morbidity.
So tell me about the improvements at the other institutions.
So across the board, it really was not using a lot of resources in terms of economic resources. What we did was put new policies, programs, and protocols in place. Dress rehearsals, emergency drills, having team meetings. I call it the big brother approach in more ways than one. It's about mentoring others and also having someone looking in at from the ministry level, which we did not have before. And it seems to have been paying good dividends, especially in the neonatal field. We have targets set for the world, it's called the SDGs 2030, and those targets are for the entire world. There should be no more than 12 deaths in babies in the neonatal period, the first 28 days of life, per 1,000 births. And that's 12. For our region, for PAHO, it's set at 9. And for Trinidad and Tobago, for the past 2 years, we've been under 8. So we have far exceeded our targets, and we are going to push it much lower.
And how does it feel to be basically the flagship hospital or health center for this? Because now the model from the Sangre Grande facility is being used across the country.
It's good. I think we've always held ourselves at a very high standard, and I'm pleased to say that we continue to hold ourselves at a high standard, and we'll just continue working more and more to get to those goals that Dr. Surjusing speaks about.
What is the ultimate goal?
The ultimate goal is to, of course, not see any mortality, but to improve the health. We're looking at reducing morbidity. Below the surface, we talked about the numbers for mortality, but there are 10 to 20 women every single month who barely get away. The teams are doing such a great job at the RHAs in saving those lives, but it's a tremendous resource burden, not just money. They go to intensive care unit, blood bank, and all of the things that we have to do just to save their lives. We want to reduce those numbers as well.
Your final comments in 10 seconds.
10 seconds. I just want to tell women to take care of themselves. We talk about maternity and health, but I think any advances you can do to make yourself healthier, not only for your pregnancy, but think long term. That's what I have to say.
All right, thank you very much, Dr. Adish Surjusing, Director of Women's Health, and Dr. Raquel Timotis. He is the Special Medical Officer from Sangre Grande. It was an absolute pleasure chatting with both of you.
Thank you.
We will have you all again to tell us a bit more on the work that is being done. So still to come